Welcome back to your Eye on Health with Dr. Sudip Bose. Every Wednesday, we are answering your health and medical questions. Now, today, we have a question that was asked by one of our viewers, emailed in. What is gout? And I hadn't heard really what gout was, so I said, Dr. Bose, why don't you take this one?
Happy to take it. And I'm glad people out there are emailing you or contacting me on my Facebook page and asking questions, because we're here to help you guys. If you have any particular questions, please contact us. So gout. Gout is a form of arthritis or joint pain. And it's pretty common. About 5% of Americans have it. And most commonly, it affects the big toe. It goes right to that joint right there. And patients who come in the emergency room, they're in exquisite pain to the point that when they're putting their sheet on themselves at night, the bed sheet, the light bed sheet, lying on their toe hurts.
Wow,
it's
that
that much
awful.
pain. Right. And the reason it happens is you're actually getting crystals, or uric acid crystals more specifically, in the joint space. So let's picture the joint. The joint is basically two bones. So picture your knee. You have two bones coming together, and the bones are sliding on each other, right? And as these bones slide on each other, on the surface of each bone, there's a smooth, kind of liquid, slippery surface so the bones can slide. That's called the synovial fluid. Okay?
That's good.
That's good. That's what you want. Now imagine in that fluid if you have a bunch of crystals, almost like rock salt, in between the joint. Yeah, that sounds painful. So let's take this. Put on this glove. Okay. So here you have a glove, and we'll use this to kind of show the joints of your hand. And here we have some salt crystals. So normally your fingers are moving, they're moving fine. And then you take this salt, and I pour some into the joint space. So instead of the smooth movement in the bones, you have just salt crystals cracking.
Scratching.
Yeah, it doesn't feel good, especially if it's in this joint in your toe, the knee, wherever else may be affected. So this is gout.
Got it.
And what needs to be done here is you need to watch your diet. These are uric acid crystals when you look under the microscope, and this uric acid is formed by what you eat. So some people are more predisposed than others. Males are more predisposed. African Americans are more predisposed. And just you may have a genetic component that makes you have this more. But on top of that, if you're eating a lot of red meat and a lot of beer, that's tough for us Texans.
Yeah, this is the wrong place for that. We love our red meat, our burgers and beer.
Yeah, that's going to be tough. So. That's going to increase your uric acid production. That's going to cause more crystals to form. So what you should do is go almost to a diabetic diet if this is what's happening to you. Less red meat, less alcohol, and if you do suffer from gout, look on the internet. Rather than us listing every single food like mushrooms, asparagus, this, that, look at the list and just know what the red flag foods are, so you can keep away from those. And drink lots of water so you can flush some of those crystals out.
So it's not, you can reverse the effects. It's not something that if you have it, you're stuck with it. There are things you can do to better.
Right. So a lot of people who are predisposed, who have high uric acid levels in their blood, they may be predisposed, they may be on medicines all the time, every day, to prevent those from depositing. And then when you get it, you can take medicines to decrease that pain. But as a constant, if you're predisposed, you should follow those diet patterns. And in general, I think even if you don't have gout, you should eat more grains, more fruits, limit the red meat and the beer. I mean, in general, these are good ideas anyway. So,
well, no wonder that our viewer asked this, because it sounds very painful.
And a lot of people are suffering from this. So thanks again for the question. And
and if you have any other questions you want answered here on the front page on Wednesdays, go ahead and email me on the email there on your screen or on Dr. Sudip Bose's Facebook page. We'll be right back. Stay with us.